world of research, it constantly changes for me because knowledge moves on. But what the campaign is offering the university is the ability to accelerate what we believe are the key challenges that face us. I have the responsibility at the moment of leading the Faculty of Medicine and Health, which is about a quarter of the University of Leeds. And the turnover of the faculty is 140 million a year, which is quite a big business, really. We train all sorts of health professionals, but more importantly, we're engaged in colossal amounts of research. We receive £50 million a year annually from our various funders, British Heart Foundation, Cancer Research UK, to undertake the research that is answering the questions that those organisations want answering. We've got 4 projects that we're wanting to accelerate through the research process and the innovation process. So the first area is textiles for health. Our people are very innovative in creating new forms of textile products, which they refer to as non-wovens, for things like wound care, leg ulcers, and fancy innovations for preventing infection. The second area is 50 active years after 50. People are living so much longer, but unfortunately, bits of the body wear out. And this is where this team comes in. Well, the third area is the Leeds University Africa Health Collaboration, building on our strengths in understanding the best ways of using money in low and middle income countries, helping them to understand how they can deliver healthcare. And the final area is new solutions for biomedicine, cancer and cardiovascular, simply because these are the 2 disease areas that kill the most people, and musculoskeletal and dementia, because these are the 2 areas that have such a negative impact on people's lives, and they're an economic drain on the country in terms of what it's costing the NHS to deal with them. What brings them all together is this notion of translating excellence in research into patient and community benefit. We're here in a hospital today, and this is where a lot of the benefit is realised.
So we've been working on active lives and joint replacements for hip and knee joints for over 20 years. And we're in a laboratory that simulates the performance and the wear and tear of hip joints and knee joints. The project in the campaign is about a new type of tissue repair called a biological scaffold. In the future, instead of getting a metal and a plastic knee joint, you will get a biological scaffold which repairs itself. Well, clearly the research at the end of the day will benefit patients. And we've already done research on new materials for hip joints and knee joints, which have been implanted now in hundreds of thousands of patients around the world. What we're working on at the moment are tissue scaffolds to repair ligaments and cartilage in the knee. And again, the expectation is within 2 to 3 years, these will be implanted in patients with arthritis to allow them to walk again.
Leeds Teaching Hospitals is one of the largest hospital complexes in Europe, and we aim to be a research-intensive organisation. And the reason for that is that clinical research, is good for our patients.
The building I work in provides an excellent collaborative environment between academic clinicians and basic research scientists. And it's fairly unrivaled in the UK. There are not many centres like this where you have high-quality, cutting-edge science on the doorstep of a hospital. The interest and the stimulus of surgical pathology, where you actually see bits of living patients down the microscope and understand the diseases that they're suffering from and how we can potentially influence the outcome for patients by telling clinicians which drugs or surgical operations the patients may potentially benefit from, then that became very exciting.
There's now emerging evidence that research-intensive healthcare organisations have better clinical outcomes. So as a patient coming to Leeds Teaching Hospitals, we want you to have a better chance of participating in a high-quality clinical research study than anywhere else. And we can only do that working in close partnership with the University of Leeds.
We talk about research being from lab to bedside, but in fact it's also from bedside back to lab, right? So it's that interaction between the scientist and the clinicians, seeing how patients react to treatments perhaps, or which patients do well and which ones struggle more with their cancer, and giving ideas back to the scientists for follow-up work.
As an organisation, we measure our success in terms of two key things. Firstly, the outstanding research that is carried out by my academic colleagues, research that breaks the boundaries of human knowledge. It takes us to new levels. And the second thing by which we measure our success is the outstanding graduates that we produce, people who go on to make a real difference in the world.
I'm researching Alzheimer's disease, which is the most common form of dementia in the world. It affects 1 in 3 people over 85. Scientists are detectives. They're doing things that nobody else in the world has done before.
It's good that our undergraduate students actually understand what they can go on to achieve personally. So we'd like to share with them the story of our alumni and where they've got to in the world.
Well, I've been involved pro bono things for a long time, chairman of Opera North, Philharmonic Society, and I've always felt a debt of obligation. I've been very lucky, and I've always wanted to give something back. It sounds awfully cheesy, but it's the truth.
An awful lot of the research that we do is to meet some of the challenges that our funders face. But the donations that we receive through the campaign are critical because they will enable us to fund the little gaps in the research, those little bright sparks that people have there where they say, yeah, I believe this is what we should be doing to speed up how we can get benefits into patients.
What I guess, and it is a guess, is that the typical alumni feels some sense of obligation and loyalty and attachment to the university.
So while we produce hundreds of graduates every year, we also take in hundreds of fresh people every year from school, from college. And during their time within the university, we want to teach them how the knowledge process works.
You can come to university and just be spoon-fed, but you definitely get more out of it by really engaging with your learning.
So it's critical that we teach them how to mine knowledge themselves. Teach them to understand that the knowledge that we're imparting in them has been knowledge that's been generated perhaps by their predecessors from 20 years ago, and that they themselves have got the capacity to go on and generate new knowledge to have an impact on health in the world in the years to come.
The biggest thing is about having brains. You know, it's having those academically brilliant people who are here, who come in and say, you know, can see something that perhaps seems a little off the wall to begin with, but in the end is the lead that you require.
The people who do the work here, the young research students, the young postdoctoral assistants, and the donor contributions will help us employ and support more researchers, more young people who will then go on in their careers to work in industry, to work in hospitals, and to deliver this technology out to patients.
There will be successes, and we've seen some in the last few years, and you take those successes and then you can carry them through, and then get other long-term funding to develop it further.
So this campaign is all about legacy. It's legacy in terms of the research that we will be doing to translate the lives of people, to patients in hospitals such as this one in Leeds, but also in healthcare communities around the world. It's legacy. It's what people have done for Leeds in the past and can do for Leeds again in the future. The Parkinson building that dominates the skyline in Leeds, the Brotherton Library where many of you may have spent hours, those buildings didn't get their names out of fresh air. They came from the very generous donations and the difference that people have made and can make again to what goes on here at the University of Leeds.
I just say give generously and go that extra mile, go beyond the point where you normally go, because it will be well worthwhile. You get a great feeling of satisfaction, and that's what it's about in my view. It's helping others. So get your hand in your pocket, write out that cheque, make it hurt. That's what you need to do. Then you've given as much as you can.